Hello, and thank you for joining us. The Southeast Mental Health Technology Transfer Center and the Region 4 Public Health Training Center are pleased to present today's town hall event, Bridging Mental Health and Public Health during COVID-19. My name is Dr. Benjamin Druss, and I am joined today by Dr. Moose Alperin, Director of the Public Health Training Center. Together, we will be moderating today's event. We'll be taking questions after the panelist discussion, so feel free to add any questions you have to the Q&A box along the way. Before we begin, we'd like to take a minute to speak about our centers that are co-sponsoring today's town hall. The Southeast Mental Health Technology Transfer Center is located in Atlanta, Georgia, at the Rollins School of Public Health at Emory University. We are proud to serve the 8 states in HHS Region 4. The goal of the Southeast MHTTC is to accelerate the adoption of evidence-based mental health programs by providing training and technical assistance to Region 4. We use a public health approach to build leadership capacity and to provide mental health trainings and resources to providers, agencies, and communities across the Southeast. We encourage you to visit the Southeast MHTTC website to learn more about the center and upcoming events. I'd like to turn it over to Moose now, who will introduce the Public Health Learning Network and the Region 4 Public Health Training Center.
Thank you, Ben. The Region 4 Public Health Training Center is one of 10 public health training centers funded by HRSA to provide trainings and resources for the public health workforce. The collective group of centers is called the Public Health Learning Network. They all work to improve the nation's public health system by strengthening the knowledge and skills of both the current and the future public health workforce. The Region 4 Public Health Training Center serves the 8 southeastern states. Our central office is located at the Rollins School of Public Health at Emory University in Atlanta, and we work with 7 community-based training partners and 3 technical assistance providers to provide public health workforce trainings and student field placements. Please visit the Region 4 Public Health Training Center website at www.r4phtc.org for upcoming trainings, as well as archived recordings of past trainings. And before I hand it back over to Ben, please know we are recording this town hall. The recording will be made available on our center's websites afterwards. And as Ben mentioned, as you have questions, please type them into the Q&A feature. We will address participant questions after the main portion of the discussion. Ben, I'll pass it back to you.
Thanks. So now that you know about us, we'd like to learn a little bit about you. Please view and answer the poll questions that you see shared on your screen, and we will review them with you. So just fill those out. So the first question is, who's your primary employer? And the second is, what's your job role? So maybe we can see how those numbers look. Okay, so it looks like we have a really nice representation across groups. We have about a third from public health agencies. Second, we have a number of folks from state public health agencies. And we also have several who are community mental health providers. And then in terms of what folks are doing, it looks like a blend of folks who are in administrative roles, health education roles, and clinical and epidemiology roles. So a really nice mix across both disciplines and roles in your organizations. So now I will turn it back to Moose, who will introduce the panelists for today's call.
Terrific. So we have two panelists today, and I would like to introduce them both. Dr. Audrey Arona graduated from the University of California, San Diego in cell biology, biochemistry, and thereafter graduated from the University of Cincinnati College of Medicine in 1991. She completed an OB/GYN residency at USC in Los Angeles in 1995, began private practice thereafter in San Jose, California, and later moved to Lawrenceville, Georgia, where she owned an OB/GYN private practice for 20 years. She served as a consultant to the Gwinnett Newton Rockdale Health Department in 2012, and in 2018 became their medical director. She is now their CEO and the district health director. Jennifer Hibbard is a licensed professional counselor with Viewpoint Health for 18 years in a variety of roles, including clinician, clinical director, and for the past 7 years, serving as the CEO. In the community, Jennifer serves on the board of directors for the Gwinnett Coalition of Health and Human Services, the steering committee for Leadership Gwinnett, and is a past president and member of the Rotary Club of Gwinnett County. Originally from Texas, she earned her master's degree in professional counseling from Southwest Texas State University and a bachelor's degree in psychology from the University of Texas in Austin. So welcome to you both. We are delighted to have you here today. And I am going to go on and kick off our first round of questions. And the first set of questions really focuses on how mental health and public health agencies have been working to address the COVID-19 pandemic. So let me start by asking you both, how are some of the ways in which your organizations have been addressing COVID-19 for the populations that you each serve?
All right, I'll go ahead and start. So we are a community-based mental health service center. So we serve individuals with mental health issues. We provide a variety of services. Our outpatient clinics provide individual, group, and family therapy. So in March, when all of this hit, we really had to pivot. We had to we really had to change our service delivery model, and we were able to implement telehealth services. So we are a moderate size organization. We have over 600 employees. We serve over 15,000 people annually. So this was quite a lift. So on March 16th, we stopped having any large group services. All of our clinics remain open. We're still open because we have to be able to serve the people in need, but we really tried to shift most all of our services to telehealth. On March 19th, just 3 days later, there was a waiver passed to allow us to expand telehealth services. And so on March 23rd, just 4 days later, we had fully implemented telehealth throughout our entire organization for any services that were available, which was a really heavy lift. It was probably about a 7 to 9 month plan that we implemented in 4 days. So once we did that, our team members and clients were able to continue to access our services, but from the safety of their home without having to come into a clinic. And then on March 27th, we had our first positive COVID case of a client. And we had some PPE stock. We did have some N95 that had been in a closet as part of our emergency preparedness. So we did have some, but on April 1st, we got our stock of PPE that we were really able to roll that out to all of our service sites that still have in-person clients, as for instance, our residential programs, as well as our crisis units. We have 3 crisis units. So that was a real big shift for us, but we were able to do that. In fact, in just the first few weeks, so prior to March, 8% of our services were provided via telehealth, and then by mid-April, in just 3 weeks, 67% of our services, of our outpatient services, were being provided by telehealth.
Wow, and good afternoon, I guess, and thank you, first of all, to Dr. Druss and Dr. Alperin for hosting this great event, and my friendship and partnership with Jennifer Hibbert has been amazing, and I hope you all will see that throughout today's comments and questions. But our health department is a district in Georgia that covers 3 counties. Gwinnett County, which is populous, the most popular or populous county in our district, Newton and Rockdale County. And we're charged with really protecting and improving, as you guys know, the health of over 1.3 million residents. When this pandemic first began, we immediately mobilized our incident commands system, so that we could provide guidance and support to our community partners, but just also organize our whole response in general. So, I think most of you know what the incident command system is like, but it's basically a hierarchy of divisions within our health department for logistics and planning and programs and just communications and every aspect, so that we can compartmentalize our responses, but also have accountability and responsibilities divvied to the right location, so that we can all work smoothly together and communicate well. So we've met for over a year now, twice a day. We meet every morning and every evening, sometimes late into the evening. And so, but it's been really important to do that. We were charged initially with setting up mass testing sites, so we could help our communities discern who was infected with the virus, and also to institute quarantine and isolation guidance. And as most of you know, we do case investigations, contact tracing, and also provide guidance and instructions for the public health measures that we all know very well. And following the ever-changing daily CDC guidance and all that's always a challenge. But now, of course, we've moved into vaccination phase of this, which includes now we've opened up 2 mass vaccination sites across our health district. So we're primarily in that mode too, still performing testing, but nonetheless more of that too.
Thank you both for that. And say, Jennifer, it sounds like y'all were not only having a huge shift, but also having to do it very quickly, along with all of us in doing that. So I wonder if you all might talk some about ways that your organizations have worked together. And Dr. Rona, can I have you maybe start this?
Sure, absolutely. Well, Viewpoint Health and Jennifer have been just an unbelievably incredible asset to us. Public health plays a critical role in sheltering for emergency responses, not to talk about just COVID, but even in sheltering. So 2 years ago, we sent a team, to support sheltering in one of our local counties during Hurricane Dorian. And fortunately, beforehand, our teams had the idea to incorporate Viewpoint Health staff in our strike team, because in the past we've encountered mental health needs in the shelters. So when we were first tasked with setting up our COVID response and COVID testing and all that for our communities, we knew that Viewpoint Health would be a huge asset to us in those scenarios. So we built, them into our process to do a check-in with individuals as they get tested. The fear in our community over this whole virus a year ago was astronomical, and Viewpoint Health is just in their mental health aspect of our response, just dealing with the public in general, was so soothing to our population, our community. And so we knew that this pandemic would take a toll on individuals. Little did we know how grand that would be, but that was our initial setup, and it's just been a blessing.
Thank you, Dr. Arona. And it was really important that we already had that relationship established, because we were able to move really fast when we really needed to make some quick decisions. And so we already had that relationship. Our team members had already had that trust. So it was really critical. I think from our perspective, the value that public health provided to us is that we had, when I said we got our PPE stock on April 1st, I went over to the public health department and loaded my truck up with it. It was the public health department that helped facilitate that, to make sure that our team members had all of the supplies and protective equipment that they needed. They also provided training on how we can conduct our own contact tracing. Because as you can imagine, at a crisis unit, we're a congregate facility, then we really, when we had a positive case, and they helped with testing, but then they also taught us how to do our own contact tracing. And then when we had exposures, their epidemiologist was able to get on a virtual meeting with our team members and really provide the education to help understand. And really with that education, that helped our fear. You know, you're fearful of the unknown and the uncertainty. And so having that education and that partner that was really able to talk through with our team members about how to help keep them safe and what to look for. And that was just invaluable. They also provided, as I said, we stopped all of our large group services. We have day programs, and a team member from public health came over to our facility and walked through the actual building with our team members and guided us through how to bring people back in a safe way, and social distancing measures, and where to put signs to wash your hands, and just really helped us through that, because they are the experts, and we were trying to figure out how we can continue having the services be accessible, but do it in the safest way possible. So it was really, really valuable. We did have a slide. I don't know if you want to share the picture. We do have some photos of our team members working together when we had counselors that are going out to the sites, the mass testing sites initially, to provide counseling and support. Our team was really happy to do that, to be able to provide that support. And really what that was, you can see our team members there in the yellow jackets, providing the counseling and emotional support, but also resource connection. There was a lot of people in need at this point. All of a sudden, they were out of work, and we had really firsthand knowledge of what we needed to do as a community leader to help with some of the resources that all of a sudden are needed, as far as food, rental assistance, that sort of stuff. So this was great to have that firsthand access point to the individuals in need.
You know, as I listened to the two of you talk, one of the things that strikes me that you both mentioned was that you knew each other before COVID-19. And I think you said that sort of the relationship dated back at least a couple of years to Hurricane Dorian and the shelter, and sort of the understanding from the public health perspective. But wait a second, we might have a really wonderful partner in mental health, and then being able to draw on that as you moved into sort of COVID-19 and the current issues around COVID-19. And I wonder, for the folks that are out there that are listening to the two of y'all and saying, gosh, I really wish that I had a better connection to my local public health department, or gosh, how do I make a connection to a behavioral health group or center in my community? What kind of advice do you have for people who might want to have the kind of relationship, in a similar kind of relationship that your agencies have?
I would say don't wait for a crisis. Start early. Dr. Arona and I also serve in Rotary together, so we are both public servants at heart. So we we connected early on through that as well. And my organization serves the same 3 counties that her public health district have. So it's really a natural fit. So I would recommend for the organizations to reach out to one another, that there is a community-based mental health center more than likely in your same public health district. So start that connection early, and it goes beyond just Dr. Rona and I. It's our team members that really learn from one another and have each other's direct contact, and are empowered to set up and forge those relationships.
Yeah, and I would reiterate everything that Jennifer just said, of course. And a piece of advice I would give is, public health and what Jennifer does too with Viewpoint Health. We really identified gaps in our community where health services and needs of our community is not met elsewhere. And so when we looked at each other, there were gaps that we had that in mental health in our response that Jennifer was easy, to fulfill. And there were, and that's vice versa, it goes both ways. But, examples of gaps would be like, in a crisis, you need mental health help, right? And so just, you could see some of the pictures where they provided a service dog just to come and help us mentally take a break. And it was amazing what that did to the staff. And you can see the smiles and, the daily stress of everything that, day in and day out, the service to our community with our staff was in no end in sight, was just really difficult. And it was just amazing what an hour of having this service animal just come and the tension that was released. I mean, it's just amazing. So just something as simple as that. And, it changes how people react in a crisis, right? And the other thing was, when we were opening a shelter, addressing the medical needs of the folks was our role in public health. And, it's easy, their mental health of those folks are not always first addressed. And so, you're looking at medical history and their medicines and their oxygen needs and different things like that. But, their mental health needs were hugely relevant to the success of the shelter. And not just for the mental health challenged folks that had mental health diagnosis, but also because this was a crisis. People had lost their homes and the situational stress was amazing. And so just the partnership with Viewpoint Health and their mental health experts was just invaluable to the whole success of the shelter in general.
The service dog's name is Clark Kent, so that's why he's got the cape. He's a superhero.
That's great. I was going to say four-legged superhero. One of the things you often hear when you talk to folks who are involved in emergency preparedness and response, sort of, share the business card on a blue sky day, so that on a, in the middle of an emergency, you have those relationships. And I think y'all are just such a wonderful example of that, and of, building the relationships early, seeking out relationships, looking for relationships in places like Rotary or other places where you interact with each other and you are not necessarily in, at your agency in particular. So no, we appreciate that advice. I think I am now going to pass it to Ben, who will facilitate the next group of questions.
Sure. Thanks. Yeah, I mean, this is just so inspiring and, really exciting to hear about. I'd like to maybe build on what some of what Dr. Arona was beginning to talk about, which is about your frontline staff in your organizations, how this has been for them, how they've been holding up, what are some of the challenges that they've been facing over the last year as they've been doing this work.
I'll go ahead and start if that's all right, Dr. Arona. So yeah, our frontline staff definitely are struggling with fear and uncertainty. And especially when this all first started, just really making sure that they had as much education as possible and supplies, protective equipment, as well as modified operations that really help them feel safe and secure. So we're dealing with fear and uncertainty about the virus, and now we're dealing with fear and uncertainty about the vaccine. So continuously providing opportunities for education and being very clear with our guidance. And then we're also dealing with caution fatigue as we continue to all, as a human race, learn to coexist with the virus. Caution fatigue is real. We get tired of having to live in this modified way. So providing support and validating that we get it. We're all here together, but then also listening to what our team members need. We have some school-based counselors that go in and provide services in the school. And with our schools reopening, some of our school counselors are going into the schools. And so do they have everything that they need to feel safe? And are they empowered to make decisions to say, based on the situation at this particular school right now, I'm going to only provide my services via telehealth, or everything is okay, and we're in a place right now where I can go in. And then at our crisis units, really being able to offer there's not as much flexibility available in our crisis units. So our community has been very supportive. Something as small as putting out the Heroes Work Here signs by our front door means so much to our staff, just to know that their community is here for them. We've had donuts dropped off. We actually got a donation of surgical masks. So bringing those to our crisis units, and them knowing that the community recognizes that what they are doing is a heavy lift, but it's also critical for the safety of our community.
Yes, and I would also add that normally in a crisis, it's short-lived, right? And you devote a lot of resources in a crisis, and all those resources are dedicated initially, but you get back to normal relatively fast. But in this case, this has been a very long crisis. It's over a year. We just celebrated, in early February, the year of our first opening the incident command structure, right? And so through mass testing and now mass vaccination, and we have staff that are committed, to being here, but we're short staffed too. And I know you are too, Jennifer. And we're very short staffed, so because of that, the staff has extremely long hours and persistent day-to-day needs for them to be present, and they know it's expected of them to show up, and they take that seriously, and their own accountability, and it's a huge mental task to really do when there's, of course, again, no end in sight, but they feel the call to show up every single day, right? And we love that about them. So, but what we've had to do, especially recognizing this near the end of last summer, is that fatigue that Jennifer was talking about was huge and overwhelming. And so, we actually had to encourage, for no other reason, just to take a day for mental health. We called it a mental health day. And just said, look, if you need this, please take this. No one's going to look bad on, upon you. And we're encouraging that. And as leaders, we took mental health days so that the rest of the staff would see that we're taking that seriously as well. We also had a dedicated scream room that we put in our health department, and it's basically a soundproof room for audiovisual productions and video things that we have. And But we really changed it to where it had a couch and the lights were dim and we had refrigerator and we had snacks in there. And so people would just be able to get in there and go away sometimes for an hour or two and just be quiet. So we've, always put a note on the door if it's occupied. And, of course, then we would celebrate milestones and, I'm kind of talking about some of the things our organization has done, Ben, but we have always done staff appreciation events. Like we would have a picnic at the end of September and we would have a celebration in December for Christmas and all gather as a district. And, our district normally has about 300 employees. And with all the staff we've had to hire, we're up to over 1,400, right? And so, but you can't do those staff appreciation gathering events in the face of COVID. So we had to be really creative in terms of how we show the staff appreciation. So we gave them, of course, the time off, but we also had drive-through lunches where we would put little gifts and stuff in a bag, notes from their supervisors and some of the leadership, and of course, a note from me, and hats and different things that we would do, and with raffles and all that. Then we even had a virtual bingo one time, which was hugely popular. I'm not sure why, but one thing that we got from Jennifer that you guys did at Viewpoint Health that we copied was, we had health department heroes that we actually snapped a picture of people when they didn't even know it. And once a week we would post health department heroes in a newsletter that would go out to everyone in the organization, just to highlight some of the funny things and some of the important work that these people are doing. So again, a lot of our best ideas came from Jennifer's team.
Yeah, really, really kind of creative ideas, and a lot of also ideas that it sounds like you guys are sharing with each other. And I'm struck by the parallels between the stresses, challenges that clinicians at community mental health centers are facing, and frontline staff in public health are facing. I'm wondering, given that so many staff are working from home, how are you thinking about that group in particular, and maybe differences in how you're addressing needs of people who have needed to be there in person versus those who are working from home?
Dr. Rona, I'm not sure if you have that many working from home. Or is everybody pretty much in person?
Well, we did have quite a few contact tracers that were working from home and had devices at home, and a lot of those were 29-hour employees, so they weren't full-time. But what we would do is try to connect with them at least once or twice a week, not to maybe come into the district office, but to talk as a group so that they could learn from each other as we go. But now that we're in our vaccination phase, we do still have some contact tracers that are working remotely, but we're really all hands on deck right now. So I think we probably have a lot less working remotely than you do, Jennifer.
So it's definitely been something that we've thought about, and how we stay connected as an organization during this time. So one of the things that we started right off the bat is at least a weekly email that comes from me that gives status updates. And we actually use the public health status update call every week. And then I include that information. So our team members get an update, a bulleted list of how many cases we have in Gwinnett, Rockdale, Newton, and how many vaccines have we issued now. But that weekly email update has really been very beneficial to our team members, because that's how we're able to stay connected. We also started, Dr. Arona alluded to it, we call it compassion in action. And so all of our team members can submit pictures or a story of something that took place. And then we put that together and send that out in the email as well, compassionate action, so that people can see one another and can stay connected. Then we actually just now started something that we're doing called Conversation and Connection. Because as the CEO of the organization, one of the things that I've missed the most over the last year is being able to pop into all of our sites and hear what's working, hear what's not working so well, and visit with our team members. And so now we're having a virtual conversation and connection and there's not really an agenda. It's meant to feel like a pop-in visit, but anybody can join the call, and it just gives us an opportunity to talk, to ask questions, to express concerns, to share good news. And another thing that kind of came out of that is some of our clinicians are recording like a little 30-45-second video clip about a tip, a wellness tip. It might be something about mindfulness. It might be something about gratitude. It's just something to help us connect with one another, and also keep us strong as we know that there's a light at the end of the tunnel. It's something that we can actually see now within our sites, but it's still a time that we still need to be able to connect with one another and have some way of supporting one another, and recognizing that there are people that are having to come into the office or come into the clinic. And then there are, based on the virtue of their job, there are some people that are able to do it more remotely. And the ones that are coming into the clinic need additional support and encouragement, and additional resources.
That's awesome. I think I'm going to steal the compassionate action from you.
Yeah, I think I hope that many of the folks that are listening in today will be inspired by and swiping some of these really wonderful ideas, because I mean I think that feeling of that sense of knowing that the organization values its employees, cares about employees. And then also, as you guys said, that sense of mission, of sort of what's getting people to, to come to work, the importance of that work is just so important. So I mean, really, really wonderful ideas. So now, Jennifer, kind of springboarding about what you were talking about kind of next steps and lights at the end of the tunnel. I want to pass it back to Moose, who's going to talk a little bit about what's on the horizon for your organizations.
And I will just chime in and say I've been quickly, ferociously jotting down ideas, because y'all have had such a myriad of wonderful ideas and examples. I'm going to look at seeing which ones I can take and steal. And Jennifer, you did talk about sort of light at the end of the tunnel, and Dr. Rona, you talked about sort of all hands on deck now with vaccination. And I certainly know that is a big issue right now for everybody. And I wonder if y'all might talk further about the issues you're dealing with now with vaccination and issues around vaccination, certainly being a big issue. And if there are other COVID related issues that you're working on in this space or anticipate working on in the next month or so.
Yeah, I can start on this one. First of all, of course, we're heavy in the vaccinations, but an equally important part of that is really the equitable distribution amongst our diverse populations and in our communities, and seeing to it that everyone has equal access to the vaccines. We're limited in our supply of vaccine and right now, and so that affects the ability to be able to get that vaccine out to those who need it the most. And as we talked about earlier, the uptake and stuff, which we're addressing as well. But it's really important to address those issues. Our state has put together an equity council, and we're dealing with this, as well at the local level. we're trying to get in front of African American churches and Latino churches and the places where the diverse populations, where those important leader faces are, because they will take all this vaccination hesitancy to a new level if we can really use their voices to connect with the people that trust them. Not that they don't trust us, it's just that they don't have a relationship with me. And so people who have deep relationships with diverse groups are very influential. And so the buy-in to them. So we're really working on strategies with community partners like Viewpoint Health and others really to leverage those relationships and get access to the people who really are hesitant or having a hard time accessing it. The other thing is we're working on is the continued push to encourage our community to now more than ever with all the variants in place, to really adhere to, the prevention measures that we've all been pushing all year round, wearing masks and social distancing and washing hands. It's really, really critical while we're working on this vaccine distribution to make sure that everyone now more than ever is really following those. So those are some of the things that we're really working on this first half of the year.
I'll just add to that we are seeing vaccine hesitancy among our staff as well as among the individuals that we serve. So we actually offered 3 Zoom sessions for all of our team members that could join, where we had our medical director, our director of nursing, and our lead pharmacist present about the vaccine. And we started with how it was developed and the efficacy and the difference between the vaccines that are out there and available. And then we also addressed some of the myths that are out there in wherever they exist. We just addressed them, and we took plenty of time for question and answer. But I think one of the things that we did that was really important, I see one of these questions in the chat, is we also validated the legitimate concern from the Black community of trusting a vaccine, because our history has not cultivated trust with some of our history of providing experiments without consent, and so really just being able to have that open, honest conversation among our team members with a trusted provider, our medical director, and our team. And then we did not mandate the vaccine for our employees, but we really are encouraging it. And we do that by getting the vaccine ourselves. And with public health, we've had with the system that Dr. Arona's team has set up to be able to provide the vaccine is just so smooth. I'm so impressed with the effort that you have, but it's been when they have vaccine available, they open up the appointments, and you can if you qualify in the phase 1A, you're able to get the appointment and then schedule your second one. So it's really been encouraging that the team members that are willing to take the vaccine are able to share their story with their fellow coworkers, and more people are becoming less hesitant. We talk about, how do you feel afterwards, and was your arm sore, did you feel bad, and just having that community and sharing our experience has really helped with the willingness. And then our counselors are sharing that information with our clients too, so that the clients will be open and ready when it's their turn in their phase.
I was going to ask whether your efforts, whether you had seen less hesitancy, and so Jennifer, thank you for addressing that. And I would think having folks who perhaps were hesitant then sharing their experiences does go a long way in others perhaps rethinking their perspectives, and also just thinking about the candid conversations that you've had and the information sessions you've had with your team members, and how that has trickled outward to counselors being able to share information with your clients. Dr. Werner, I wonder, as you talked about thinking about who some of the, this is my choice of words, but the opinion leaders or the other kinds of leaders in the community, and seeking them out and seeking their guidance and their partnership. Have you found that there has perhaps been less hesitancy, or perhaps there hasn't been enough time yet to see, but what are you seeing based on those kinds of conversations?
Yeah, great question. And I'm encouraged because, first of all, the demand for vaccine has been very large, right? And our supply is very small. So demand far exceeds supply, which makes it frustrating for people to get vaccine. But again, like Jennifer was saying, when they get an appointment, then, we want the process to be as smooth as possible. So, we've really tried to prioritize that. But what I've noticed is that, I'm trying to put my face in every church, every organization, every United Way event. We just had in our county a John Lewis Day inaugural event, and I just was like, going, can I please just address your audience? Let me be part of this, and so the persistent messages and the transparency that public health needs right now will go a long way in developing trust of our community, number one. And then, like I said, getting the leaders on board. So the African American church leaders, and I've asked them and have been able to participate in Facebook Live events with them where we actually ask the parishioners their questions. And I have seen from those individuals that seem hesitant about it, there is a larger uptake. We are getting lists now from African American churches where their parishioners are signing up for the vaccine, and we're trying to accommodate to make sure that they all get scheduled as a priority. And so it just takes time to be able to get into these specific corners of our county that matter. We're doing the same with Latino churches, and the Hispanic Chamber of Commerce for Georgia, and Latin American associations, and different community partners at the, not just faith-based, at the community level, community centers and stuff that service these diverse populations at all. Just to be able to get there, provide accurate information, timely information, and answer their questions. And sometimes it's just being a listening ear to show that you really are there and wanting to hear the reasons for hesitancy, and being able to answer those questions with accurate information goes a long way. And so I would encourage everyone to really kind of, it takes a lot of work. My calendar is out of control, as Jennifer's is too, but the effort is worth it.
No, it's wonderful to hear about how you've been working, how you both have been working to build trust, to listen, and to truly hear what people are saying and hear concerns, and then work at building trust. So we've been talking about sort of, there's light at the end of the tunnel, and now what I'd like you both to sort of think about is we're at the end of the tunnel, and I want you to perhaps share some thoughts about, as you think about what this last year has been like, what kinds of changes you have made. Are some of the changes things that you see persisting after the pandemic ends? After the pandemic, is there going to be a new normal? What does that new normal look like for your organization? So, a little bit of sort of looking into the crystal ball and projecting us a little forward from where we are now, but thinking about after the pandemic and what kinds of changes will last and what a new normal might look like.
Jennifer, you want to go ahead?
Sure. I'll look into my crystal ball first. I think that one of the things that has helped me weather this difficult time is to try to find some of the positive aspects that has been born out of this. For us, I think some telehealth needs to exist in the future. I think that this is very important, not just for the behavioral health community, but for healthcare in general. I think that we have proven that telehealth is effective. One of the things that I have to admit is that prior to the pandemic, I was not a big fan of telehealth. I'm a therapist, and I feel like that face-to-face connection in my office is the best way to be able to provide care. And telehealth was just only if it's the last resort. And now, after seeing and learning so much about the benefits of telehealth and seeing our individuals that we serve embrace telehealth and thrive with the ease of access, and we're able to de-escalate crisis. We're able to avoid a crisis inpatient stay. We're much more involved and accessible. We don't have barriers like transportation anymore, and we don't have, if somebody is running late for their appointment, the counselor can send them a text or an email, and it reminds them, and they jump right on. I mean, our no-show rate has gone down. So all of that to say, telehealth has to stay in some form or fashion, maybe not wide open the way it is right now, but we've learned so much, and I think we can't just go back. We can't put the toothpaste back in the tube for a silly saying, but I think that's definitely one of the things that needs to continue on. I also think that some of the communication strategies that we've put in place as an organization is they need to continue too. So this conversation and connections, and we're going to continue to do that virtually. Because we are spread around. We've got 48 locations, so this is a great way to connect with our team members and to have them connect with one another, even if we are all back in the office somewhere. And it's more efficient. We don't necessarily all have to leave our office and come to a centralized place to have a meeting. We can transfer the knowledge and the information this way. So I think there's a lot of benefits, and I'm hoping that some of the partnerships that we have forged, of course, Dr. Rohn and I were already partners, but we've added a lot of partners to our little group. So I think a lot of those partnerships will continue on as well.
Yeah, that's great, Jennifer. And I would add too that, I'm always been told I'm the eternal optimist. So I too always look at the good things that come from things such as this pandemic. And one of the great things that I think everyone in public health would really acknowledge is the fact that, public health awareness and its relevance to, at all levels of our communities and our businesses has really been dramatically exemplified this last year, right? And so, I mean, even some of our measures, look what all of our measures did to influenza. If you look at the deaths from a year ago, it's just amazing differences in just influenza deaths alone from one year to the next. And we've always had close community partners with, like Jennifer and some other groups, but those community partners have grown, meaning we have many, many more community partners now that we didn't know or have before, like Jennifer alluded to. And also I would say that those partnerships are richer. They are just much, much, much richer. And, as far as the new normal for our organization and a great idea that, I've been looking at is we really want to leverage those relationships and the public exposure that we've gained this year. And I think by leveraging that, what I mean is that we can improve our presence and also what we do in almost every sector of what we do. For example, a small example of that would be like our restaurants. We inspect restaurants in environmental health as part of public health. And so we do that because we want to keep proactively ahead of the game and identify problems before they become an issue for our community, right? And why are we not doing the same thing for our long-term care facilities and assisted living facilities, right? So we're not regulatory, but we do inspect them, or we should be inspecting them instead of just responding to outbreaks of disease. Why are we not in those places ahead of time doing our our work there to prevent those types of things from happening when we identify prevention measures that are suboptimal. So again, I think there's a lot of ways that public health can really insert ourselves in better ways within our community to keep our communities healthier and protect them from some things. And I think now is the really great time to do that, given that pretty much anybody could tell you what public health does right now, as opposed to a year ago. Well, more than a year ago, people didn't have a clue what public health was or did. So anyway, we're just thinking along those lines, and that's going to take some different potential funding options that are different for public health. And I, for one, am really looking at some strategies to make our public health funding a little bit more stable instead of so reliant on, legislators to give and take and that type of thing. And so I think this is a really good opportunity for all of us to excel in those regards.
Well, I love the optimistic perspective. I have a little bit of that myself, and I do think as a public health person, there are a whole lot more people that, as you said, know what we do than did a year ago. Well, I will say that this has been absolutely wonderful listening to you all share your experiences and share the collaborations between yourselves and your organizations, and trying to catch up on. I think we have some people who have put some questions in the Q&A pod. I would like to invite participants, if you have questions, please do put them in the Q&A pod so that we can ask Jennifer and Dr. Aruna to address them. And I think at this point, I am going to turn it back to Ben.
Sure. Hold on. Yeah. So as Moose said, first of all, just thanks. I mean, this has just been great, and I think will be a great springboard into Q&A. So feel free to put your questions in, and we will answer as many as we can in the next half hour or so. So the first question is building on, I think, some comments that we already have heard a little bit about, but we'd like to hear even more about, particularly given the disproportionate impact of COVID in African American communities, as well as the potential for concerns around vaccine. Just any more reflections that either of you have about how you have specifically been addressing these issues related to the African American community.
Yeah, I can start on that. So, like I mentioned, we do some Facebook Live Zoom events with some faith-based organizations. We also were included, public health was included in a conversation with the United Way, where they had organized an event to try to, and I think there was about 400 people present for that. We have a congresswoman from Georgia who organized a COVID advisory council that addressed some of the issues with equity surrounding the vaccines and all. And so they hosted an event where they had a large number of the community attend to, again, answer questions, provide information about case rates and numbers and all that, but also then talk about the vaccine and how to get appointments and what's on the horizon, and again to talk about their fears and concerns. The question answer sessions of those types of forums and events are hugely critical, because one person's question is most likely the question of a lot more. The other things, we're working with the NAACP here to try to put together a very large summit. And again, public health can't put that together, primarily because I need my community partners to help me get access to those deep corners of our community and our county where people live. and invite them, because I just don't have access to their names and all that to welcome them to things like this. So again, just leveraging those partnerships, and the same with the Latino population as well.
I would just add one item to that. We do have an outpatient clinic that is located in Gwinnett County, which is an incredibly diverse county, but this one particular clinic does focus on the Latino population. And all of our staff are bilingual or multilingual, and we provide multilingual, but also multicultural and significant counseling. So we do have trusting relationships there. So that is one of the areas where we really are trying to provide more education and facts regarding the vaccine from somebody that the community trust. And of course, not because we're still in phase 1A, if you're not 65 or older really, or in healthcare, then you're not quite ready for it yet. But we're still taking this opportunity to continue to provide that education to get ready for when the vaccine is available.
Great, thanks so much. So the next question is about the FEMA CCP program, which is, I believe, the Crisis Counseling Assistance and Training Program. Whether either of you have any familiarity with that, whether you use that in your organizations.
Dr. Rona, is that the same training that our teams got back in Dorian? I remember our teams did go through a training.
I think we did that. I just don't know specifically. I was looking it up to see exactly what it was, and this was in areas that received that presidential major disaster declaration for individual assistance that was requested by a state. So I'm sorry, I don't know the answer to that question. I don't know. Do you, Jennifer?
No, I just know that that the team that helped respond to Dorian did get a training. That's all I know. I don't know what the title of the training was, but
yeah, completely fine.
I'm going to make.
So the next question is about adaptability. So there, as both of you mentioned, this is, the directives, the landscape, public health policy kind of change from week to week, day to day. So, how have you as organizations or dealt with those changes? How have you kind of helped your staff to cope with adaptability to respond to so many changes?
Yeah, we've certainly seen that too. This response is, I think that's probably one of the hardest things that has occurred this last year for all of us, is that every single day, the change, you can prepare for this thinking that this is the way things are going to go, and then the next day all the work that you just did is irrelevant because of some change. And so I think having the incident command structure that we have, where all the leaders are in our room twice a day, so that that communication is just so critical. And what I've noticed is that our staff, because of Jennifer and her staff, we're so much more cohesive, and we've learned to really see things in each other that would lead to one of us saying, what, why don't you take tomorrow, take today, we just kind of see mental cues from each other. And when one half of us gets frustrated, the other one seems to have strength. And, I'm very spiritual, I call it prayer and, divine. And we all have servant hearts in public health, as you know, because none of us do this for the money, that's for certain. But, I think it's just that that staff being able to really be cohesive and together and provide support for each other and cover each other, and that type of thing, that's been immensely helpful. It's really hard. I mean, with daily changes and all that, it's you have to laugh about it or you cry about it. But that just seems to have gotten us through. It's the togetherness of our team.
I would agree with everything that Dr. Arona said. And then I also think that I would add that we kind of live by the motto that clear is kind. So we want to be really, really clear with the guidance and with the direction, with the education that is available to us, but then also give us grace. We give each other grace. And if you're stuck one day because it's just not something you can't make that change that is being requested of you or required, and then you get there the next support to one another and continue on with communicating and educating is so important, and then recognizing that, hey, we were wrong, that did not work, and we're going to stop. And that's what we've got to do, because we are very much in uncharted territory right now.
Yeah, and the other thing I would add too is I recently listened in on a training that Disney uses, and they have 4 keys to basic behaviors for Disney, and the first one is always safety. So if we're all watching out for the safety of each other, number one, and the next one is show, where we just really no one takes credit, but we basically put on public health as we give each other credit for things, and then the next thing is courtesy and efficiency, and the courtesy that we extend to each other and the efficiency that we all do our work and we're held accountable by each other for that. I mean, they just all seem to really work together, and I would say that that's also a really, really important, the person's experience that whether it be testing or vaccination or anything else, our clients that come to the health department to receive any kind of service, really, their experience has to be a manifestation of what the values of our public health organization is. And so just that motto alone will help keep yourself in check even when you're having a bad day.
Thanks. That's great. So the next question is kind of a logistical one, which is when you're communicating with the population, is that happening with a Zoom webinar? Are you, is this all virtual? Are you doing any kind of other ways of outreach in person or other modalities?
I can start if that's okay, Jennifer. We use several options. We have a community partner call that's basically just on a conference line every Wednesday morning. And so partners from the hospitals and nonprofits and key leaders in the community, the community foundations and Viewpoint Health and a lot of other partners are on that call, listening to the latest information about our numbers, our vaccination efforts, what we're focusing on. We're doing this with testing. This is the new thing. This is what we're projecting. This is what we're hearing about the future phases. This is our allocation of vaccine. This is what we're working on. So that's been really helpful. And on Fridays, we would have, when it was important with the long-term care facilities, way back when our numbers were super high, we had a long-term care facility call on Friday afternoons, and we hosted a conference call with our educational partners at the time when they were planning, last summer when they were planning to go back to school and having some issues, needed guidance and information from us so that they could make good decisions about those issues. So the conference calls were really good. And then we do put together Zoom conferences. We do Microsoft Teams with our state office, different platforms like that. We have a healthcare roundtable in our community that hosts a summit. And we've got a fourth one coming up in March up for that. And, and it's an hour and a half conversation with some presentations from like the CDC, Chief Medical Officer of the CDC, and then we'll have some people at the state office that are provide input about certain things. Jennifer's presented before about mental health aspect of COVID, and sometimes hospital CEOs are commenting, on those things. Again, just all in an effort to provide as much communication to our community as possible.
And I'll just add, I am not out there nearly as much as Dr. Arona is. She is way more public facing than I am, but I have had some opportunities to present, and I've got a presentation about mental wellness amid a pandemic, which is really meant for everybody. I kind of take a public health thought about mental health because I feel like everybody needs it. I think it's kind of like putting fluoride in the water. Everybody needs to have some mental health tips. So I've been presenting at some Rotary clubs. I've done some virtual Zoom sessions. I did a recording for anybody who is kind of reaching out. I'm trying to make myself available. The public library is launching a campaign about mental wellness, and so I provided some information there. So just whoever is asking, I'm trying to make myself available and make the resources available. Because I do think that more and more people are going to need access to care as our mental wellness is being tapped during this time.
Yeah, thank you. So there are a couple of questions about schools. First is kind of building relationships with schools around this, addressing the needs. And then the related question is just around kind of the potential impact on school-age kids from all of this. So would love to hear your thoughts about that.
So I'll start because our partnership with the schools in our area started way before the pandemic. We've been in partners with our local schools for more than 13 years, where we've been able to have screening and even just assessments. And then now we've grown those programs to now being able to offer in-house clinicians that can go in and provide services right in the schools. And then in particular, I think I saw in the question in particular about risk of suicide or self-harm. We have taken the opportunity to look for some grants. A lot of grants are coming out with some of the funding that is available. So we have recently been awarded a suicide prevention grant where we're going to be able to provide evidence-based training to our school partners and other child-serving organizations so that, again, that public health approach, the more people we have that are trained and aware of how to recognize signs and how to connect to care, the better and healthier our community will be.
Yeah, thank you, Jennifer. And I would also say that, we've been blessed. Our health department has a very, very good longstanding relationship with our school systems here, and have enjoyed, that not only just for outbreaks like for norovirus and different things like that, but also especially with COVID, we were, at their table discussing, case rates and different factors that might provide additional input in their decisions about having school present or virtual. I actually visited a high school, a middle school, and an elementary school with the vice superintendent to look at what measures schools had put in place. And as you know, there's different not priorities, but different challenges that each one of those levels of education have that the others don't, and how they addressed all that. And so, you know, and again, the relationship was just so important. You know, I stressed over and over how I didn't have to make the decisions about in-person versus virtual school. And I pitied them because they had to make that, but yet at the same time, I could give them information and guidance about the measures to make them feel safe, that if they chose the inpatient school route, that this would be that it would be safe for the kids. And so we would do press events together at that level. And again, not, you know, the transparency of these relationships, and also what information is shared at times like that is really important, and just breeds trust for all of us at that point.
Great, thank you. So I see another question about telehealth. I know, Jen, you had started talking about some of the benefits. It looks like there's a question about sort of some of the trade-offs. Do you see there as being any trade-offs? Are there sort of populations in whom it's more difficult or more beneficial?
Yeah, there definitely, telehealth is not perfect. I think that there are definitely some cases that we struggle with more. I would say internet connectivity is an issue in a rural area, that could pose a barrier. Right now, the waiver does allow services to be provided just over the phone if they don't have video capability. That's not ideal. I think moving forward, if the telehealth was expanded, I do support the video capability as a requirement. Right now, I was a huge advocate to be able to let the waiver be just by the phone, because we didn't have all of our clients set up with being able to use video. So that is, but I think moving forward, you do need to have that sort of stuff considered. Not every client is willing that. So like I said, all of our clinics still are open, and we try to be as safe as possible. And then of course, some of our clients need medication that is delivered via an injection. So they need to come in for those services as well. But there are some cons. It can be a little more expensive. So fortunately, we're able to apply for the telehealth grant that came through the FCC. So that helped us recoup some of our cost associated with that. So it's not perfect, but it certainly did improve in a lot of ways.
Great. Let's see. So we have one that literally is just coming in that is about, yeah, I mean, and I think it's sort of building on some of the points that you've been raising about reaching, you know, sort of like the segmentation issue when you're trying to get messages out. How do you think about, you know, maybe giving different messages to different age groups, you know, millennials versus baby boomers? You know, how do you think about that tailoring process as you're getting the messages out?
I can start on this one, Jennifer. You know, this is really important, and what you are talking about there is really thinking outside of the box, and using celebrity figures, that type of thing, is very important. Tyler Perry in Atlanta getting a vaccine shot did a lot for, I would say, for vaccine hesitancy and other things. I can tell you that, you know, our communication department here at Public Health works with the county. We also work with the municipality association, trying to kind of have similar messages and leveraging those relationships and partnerships to communicate at a grander scale. And a couple things that came out of that was one, there was a moms listen to moms campaign. Your mom tells you to put your mask on, your mom tells you to wash your hands. And they're also, at the county level is spreading that kind of campaign where they're saying, look, listen to your mom and get the vaccine, or, different things. And another one that we did was kind of join the team, trying to use a sports theme where, join the team and do these measures for the overall community good. And another one that we're working on right now, just because our vaccine supply is so limited and we've had a lot of people, especially our elderly population, have a more difficult time accessing appointments, is, we're pushing out a campaign to help your neighbor. So if you have a neighbor that is elderly, maybe connect with that person and see how you can help them. Do they need a transportation route to get to their vaccine? Do they need help registering for the vaccine? Do they need groceries? What do they need? And so, but again, you're right in there's several different platforms for different groups. And I know social media platforms are huge now, and even Instagram and Facebook, on all those Twitters. I mean, I'm not great about all that, just because I'm not I'm in the baby boomer, I guess you would call me, but I would certainly say that that those are important things to consider when you're trying to get communication out, for sure.
Thanks. Well, we're coming close to the end. There have been a few other questions that are around how individual people can get involved. Perhaps with those, people are welcome to reach out. We'll give you some contact information at the end, both for the MHTTC and the Mental Health Technology Transfer Center, and also the Public Health Training Center. So if you have questions, that are about ways that you might get involved, and we also can be in touch with Dr. Arona and Jennifer Hibbard. And I want to end with one item in the Q&A that I think speaks for all of us, from Matt Davis, which the question here is, do you know how truly grateful we are for both of you? Both of you rock. So I can't think of a better way to end. It's certainly, I think, reflecting how I feel. I'm sure how Moose feels, and how all of us feel, both for your presentation today, but more importantly, for everything that you've been doing over the past year. It's just been, really inspiring, and we're just, incredibly grateful. So with that, I'll turn it back to Moose, who can kind of help us wrap things up and finalize things. Thanks.
No, and I will add my enormous thank you as well. I was going to say that was a great comment to end on, and as Ben said, not only for today, but for everything you do for our communities, an enormous, enormous thank you. To wrap things up today, I just want to share a little bit about evaluation and remind you to come to our websites. But the Southeast MHTTC and the Region 4 PHTC really do want to thank you for participating in today's event. We value your feedback, and we would like to ask you to complete the 4 poll questions that you now see on your screen. These 4 metrics will provide feedback to the Region 4 Public Health Training Center about the impact of today's conversation on your work knowledge and skills. We'd also like to invite you to complete a SAMHSA required survey by clicking on a link that we are going to put in the chat box for you. Completion of this survey will provide information to the Southeast MHTTC and assist us in planning future events. Afterwards, you will be automatically redirected to an additional set of questions from the Southeast MHTTC regarding the impact of this event on your knowledge and skills. There, you'll have an opportunity to download a certificate of completion for your records as well. Please do allow about 5 to 10 seconds for your browser to redirect you to the second survey after the webinar ends. And again, our centers truly appreciate your participation and your feedback. Another enormous thank you to Dr. Arona and Jennifer. And we hope that you will visit our websites to learn more about both of our training centers and learn more about upcoming training opportunities. And this will conclude today's presentation. Thank you all.